Good evening. My name is Sarah Haddix. I have been a registered nurse for over 10 years. My background is primarily intensive care or critical care. However, I've spent a large part of my career working in a neurosurgical neurology ICU, caring for patients with brain injuries, including stroke. Today I'm going to share with you some information on stroke, ways to prevent it, and what our team will be doing to help those who have suffered from a stroke. The people in this room have been selected to be members of the facility's newly formed stroke team. In order for us to be effective and make an impact with this program, we need to be knowledgeable in regards to all areas of stroke, from beginning to end. During this presentation, we will discuss what a stroke is and the goals of our team. We will discuss who stroke affects, risk factors for stroke, and prevention. We will review the pathophysiology of stroke and look at how stroke is diagnosed. We will then look at treatments and outcomes for our stroke patients. At the conclusion of this program, you will have gained sufficient knowledge to be a competent member of our stroke team and positively impact the lives of our stroke patients. According to Misha et al. 2015, approximately 795,000 people in the United States are affected by stroke each year. Stroke can affect any person at any time, regardless of age and race. The American Stroke Association released a campaign in 2004 stating that time lost is brain lost, in order to encourage those who think they are experiencing the symptoms of stroke to seek treatment sooner. Prompt treatment is also important, as the mortality for ischemic stroke is between 8 to 12%. One major key in preventing stroke is to identify those risk factors associated with stroke and learn how to prevent them. According to the National Institutes of Neurological Disorders and Stroke 2011, certain goals and care standards have been established in regards to stroke care. First off, the establishment of a hospital-based multidisciplinary stroke team is essential in ensuring this population receives the best care possible, which is why you all are here today. Early identification of stroke and evaluation by a physician is also highly important and should be performed ideally within 10 minutes of arrival to the emergency department. Head CT should be performed within 25 minutes, with results back within 45. Treatment of stroke can vary depending on several factors such as time since onset of symptoms to treatment, type of stroke, and severity of stroke. If the stroke is ischemic in nature, thrombolytic therapy with TPA is the recommended course. After stabilization and initial treatment in the emergency department, the patient will be admitted to an inpatient unit, preferably one that specializes in stroke care. They will be monitored closely and reevaluated using the NIH-SS scoring system. The rehabilitation process should begin within 72 hours following the stroke and should begin with evaluations conducted by physical therapists, occupational therapists, and speech and language therapists. Although having a treatment plan in place is very important, we also need to know that in most cases, stroke is preventable. This begins with recognizing those areas that can be changed, the modifiable risk factors, and those that cannot. Non-modifiable risk factors include age, race and ethnicity, low birth weight, and genetics. Modifiable risk factors are things such as high blood pressure, diabetes, cardiovascular disease including atrial fibrillation, high cholesterol, obesity, physical inactivity, as well as smoking and alcohol consumption, as they also contribute to one's chances of having a stroke. Prevention of stroke is prevention of these risk factors. This can be accomplished through diet and exercise, quitting smoking, consuming alcohol in moderation, taking medications as ordered, and maintaining good blood glucose levels. Making sure you see your physician at least on an annual basis will also help to warn you if you have any of these or are at risk for developing them. Let's now take a step back and take a closer look at stroke. There are two types of stroke, ischemic and hemorrhagic. Ischemic strokes occur when the blood flow in the brain is obstructed. Hemorrhagic strokes occur as a result of a ruptured blood vessel in the brain. Hemorrhagic strokes are associated with a higher mortality rate, although they occur less frequently. Ischemic strokes are more common than hemorrhagic strokes and account for 80 to 88% of all strokes. Presenting symptoms and eventually rehabilitation and recovery will in large part be dependent on which area of the brain is affected by the stroke and the type of stroke. As we just discussed, type of stroke, its location, and its size are all important factors in stroke symptoms and outcomes. Many stroke patients report a severe headache or feeling of pressure at the onset of the stroke, particularly in hemorrhagic stroke. The most common symptoms of stroke include decreased coordination or impaired mobility, numbness on one side of the body, inability to move the limbs on one side of the body, speech difficulties including slurred speech or trouble forming words. Visual disturbances and sensory disturbances are also often reported. Often stroke symptoms can be vague and they can mimic those of other diseases. These include things such as dizziness, nausea and vomiting, and generalized weakness and malaise. Our most important tool for the prompt recognition of stroke is the NIH-SS Stroke Scale. This scoring tool offers a quick, detailed assessment of stroke and its impact on the patient. Obtaining a head CT as quickly as possible is also critical. This will let the provider know what type of stroke they are dealing with and which course of treatment to pursue. MRI is also a useful diagnostic tool, but only after initial treatment has been provided, since these take approximately 45 minutes to an hour to complete. Laboratory studies are also important and paint an overall picture of the patient's health status. Laboratory studies include things such as complete blood counts, prothrombin time, partial thromboplastin time, international normalized ratio, comprehensive metabolic panel, and liver function tests. Now that we have hopefully expanded your knowledge on stroke, let's talk about what each of you will contribute to our team. We have established a multidisciplinary team under the direction of our stroke neurologist to ensure the best outcomes for our patients. I will be acting as the stroke coordinator and director of the program. Our physical therapists and occupational therapists will evaluate each stroke patient within 72 hours of admission and formulate an effective treatment plan to help these patients regain as much of their mobility and prior level of functioning as possible. Our speech therapist will administer a swallow evaluation to prevent aspiration as soon as the patient is advanced to oral fluids. The speech therapist will also evaluate the speech and cognition of each patient and set up appropriate treatment plans for those areas as well. The dietitian will advise on the diet while in the hospital, as well as provide a menu for the patient upon discharge. This will include things such as cardiovascular diet, diabetic diet, and other foods to avoid depending on medications. Our pharmacist will review medications on a daily basis and help with education regarding any new medications that the patient might be prescribed. Our team will participate in multidisciplinary rounds daily to discuss the progress of our patients and where they are in their rehabilitation process. One of our highest priorities will be to educate the patient and their families to help prevent another stroke from occurring. In closing, I think our stroke team will make a huge impact in this facility as well as with our stroke patients. I look forward to working with each of you, and I hope we have enhanced your knowledge of stroke. Thank you for coming, and good night.